nodes all along that area, and there's one that's kind of higher up that I'm worried about. Right. But if they're in a situation where it could happen, they need to know that that's a possibility. And I just believe in that core principle so deeply that it really guides me in how I talk to every single one of my patients. Tell me what you know about your lung cancer.
I have just really known for 3 days that I have cancer.
Okay.
I was just diagnosed.
So what was wrong? I remember as a resident rounding with lots of fantastic physicians who would walk into a room with a patient. They would say, everything is fine. You know, you're getting better. You'll be getting out of the hospital soon. And then we walk into the hall. We walk a few steps away from the door. And, you know, very casually, oh, you know, that guy's not long for the world. And why should we as physicians have all of this information about the patient? It's the patient's information. Are you interested in knowing numbers about your prognosis? Are you interested in that kind of thing, or are you too overwhelmed with all of it to...
Yes, I'm the type of person that likes to know as much information as possible.
When we're dealing with a stage 4 lung cancer, we know that it is not a curable situation. It is treatable, and we can do things to intervene and help you live as long as possible. But because this cancer has spread through the body, it's much more likely that this cancer is going to be the thing that takes your life rather than something else.
Well, you gave a deeper explanation than I had heard earlier today, so it's pretty...
Well,
it's really incredibly hard to sit down with another human being and look them in the eye and say, I'm sorry, but there's nothing more that medical science can do to make you live longer or better.
I wish that we had some magic medication that would make this all disappear. All of the treatments are to give you as much time as possible.
Most cancer is very predictable. Once it comes back, unless it's a curable disease, of which there are a number, it's going to be the end of that person. And there are certain tasks that the person should do before they die.
And that's just being, you know, as straight about it so
Which I
that
appreciate, yeah.
you have a good sense of what you're really dealing with, and you can make the best choices in the context of your life, knowing that we might be on limited time.
Well, this just really sucks.
It does. And I'm sorry.
Yeah, me too.
If you're hearing about that 4 weeks before you die, you're probably not going to have a chance to go to LA and make up with your brother out there. You may not have a chance to talk to your priest or rabbi at a time when you're really well. And all of that can be helped by just being more honest with people during the course of their illness.
I just hadn't been focusing on...
All the data suggests that directly addressing symptoms, relieving their pain, keeping them more functional, allows them to live a longer period of time as well as a better period of time.
I've been trying to do what I want to do, you know, live life to its fullest and to enjoy it. Well, it has a different look on it for the next couple of years, I think.
Yes.
Dr. Cole's approach is relatively new. For decades, so-called palliative care was almost taboo in oncology. The focus of cancer treatment was on eradicating tumors at all costs. Doctors did little to alleviate the pain or address the psychological needs of dying patients.
To many doctors, the word palliative care